Among those challenges that I already mentioned, I would also underline the limited basic social services and limited social protection scheme, low-income economies, large informal sectors, and limited livelihood options in the context or in a particular context impacted by climate change, land degradation, water scarcity in some areas are compounding an already fragile situation. Today, we are gathering here and to discuss in detail the impact of the crisis in an already fragile situation. So I will, with no further ado, brief on the agenda of the today briefing that will be segmented in 3 parts mainly. So the first part will be dedicated to an overview of the situation and the IOM priorities to be outlined by the Acting Regional Director of IOM in West and Central Africa, Mrs. Sophie Makar. After the presentation of the COVID-19 mobility and population across the region, including a focus on IDPs, Sophie will explain further the 3 priorities based on principle of humanity, inclusivity, and mobility. And these priorities are to include migrant in national COVID-19 response, to strengthen disease surveillance at the border so border can reopen as quickly and safely as possible, and to leave no one behind. So the second segment of our today briefing will be a presentation by our colleague Vijaya Sori, who is the IOM Regional Immigration and Border Management Specialist. And Vijaya will present IOM appeal for the West and Central Africa and the specific funding requirement to overcome the main challenges posed by the pandemic. And finally, the third and most, I think, interesting as well for you to have the glimpse of the realities faced that the IOM is facing on the ground would be 4 presentation by our Chief of Mission in Chad, who is Anne-Catherine Schaeffer, and will focus on the awareness raising and risk communication and community engagement. And our mission in Niger, who is Barbara Risk, but she cannot unfortunately be here today because of urgent matter to deal with the return of stranded migrant in Mali. She will be replaced by Peter Kyo, who will focus on stranded migrant impacted by COVID. And our Chief of Mission in Guinea, who is Fatou Ndiaye, will give an overview of the health, in particular point of entry and infection prevention control. Our Chief of Mission in Nigeria, France Celestine, will provide us with information regarding person internally displaced by the Lake Chad Basin crisis in North and East Nigeria. And finally, if time permits, and particularly if technology allows, we will listen and through videos to migrants whose stories wanted to share with us how their life and activities have been impacted by the pandemic. And more importantly, the final session will be dedicated to a Q&A session to provide you the opportunity to raise issues that has been and to ask about question or a recommendation to give us on what has been presented to you today. So I will now provide to Sophie the opportunity to brief us for 5 minutes on the situation and IOM priorities. Sophie, over to you.
Thank you, Vijay. Thank you, Aisata, and good morning, everyone. So I will just give you a few words about the impact of COVID on mobility, and then I will move on and say a few words about the impact of COVID on the humanitarian situation. You have heard from Aisata as a figure and the importance of mobility in this region. We also know that in this region, all the countries put in place some kind of borders and mobility restrictions, but as well as other restrictions in order to reduce the spread of the pandemic. And we can say, and we can already assess at this stage, that it has had a very strong socioeconomic impact, but also health impact for millions of people on the move. There's many migrants who have lost their job because of the economic restriction, but there's also many more who are not able to return to their job because of a border mobility restriction. In terms of health, I would like to praise the government of the region because they followed the WHO recommendation and introduced free testing and free treatment for everyone, regardless of their nationality. However, that doesn't mean that these services are accessible by migrants for many reasons. One of the reasons I would like to flag is just because sometimes this information doesn't reach out to migrants. And another important reason is also about the legal status of some of the migrants. For irregular migrants, they are really afraid if they ask for these services to be deported, to be arrested. So they prefer not to avail themselves of these services. But what was the impact of this restriction on the mobility in general? I would like to encourage you to read the map that you can currently see on your screen. And I think what we could see from an IOM perspective is a sharp decrease in the movement in the region. If you compare the figure of, if you take the figure of last year, April 2019, and you compare it to the figure that we have in April 2020, I think there's more than 44%, there's more than a 44% decrease of the mobility within the region. You can also see from the same map that because of the borders closure, we have a situation of more than 20,000 stranded migrants in this region. But on top of that, you also have a situation of more than 2,300 migrants who are stuck in transit centers. These numbers are about people who were trying to reach their way back home and were stuck in the middle of countries like Niger, Mali, Burkina Faso, or Chad because of the closing of the borders. Now, if I move to the impact of the COVID on the humanitarian situation, voilà, thank you for the map. You also, I think, please, I encourage you to look at this map. And what we can see is that in this region, we have about 6 million IDPs currently in the region. And most of these IDPs, they live either in camp or camp-like setting, or they live, in fact, in close quarters among the host communities. And this condition of living make it very difficult for the IDPs to respect barrier measures and to protect themselves for the COVID. In addition to the situation of the lodging and lodging condition, I think there's another impact of the current restriction, which highly affects this population. And this is the fact that because of the airport closures and land border closures, you also have limited access for humanitarian actors to provide and deliver assistance to these people. In addition to that, in many places, especially around camp, there's prohibition to exit and enter this camp. And this situation led IDPs not being able to avail themselves of a certain number of services, being social services, health services, or just the capacity to try to secure an income. In terms of mobility and mobility of the IDPs, I think just to give two examples on how COVID affected also the mobility of the IDPs, I think I would like just first to flag the situation in Cameroon. Because of the difficulties of availing themselves of basic services, what we saw, it's about 11,000 IDPs, which are displaced from the northwest, southwest of Cameroon. They have opted to return to the areas of origin to ensure the access to services and livelihood during the pandemic. Another concrete example about the impact on the delivery of assistance is about the Lake Chad Basin and area. And in Chad, for example, I think the government, in order to ensure that IDPs have a level of access to humanitarian assistance, they decided to move IDPs, around 12,000 IDPs from Jamron, which the government has declared a war zone, to Ama, which is a safer zone, in order to give access to humanitarian actors for providing assistance. These are just two very striking examples among many. So, not to take too much of your time, I just would like to flag which are the priorities we see as IOM in this context. So we see three really important priorities for action at this stage. And the first one, we fully understand the importance, I think the fact that the government decided to close border to reduce the spread of the COVID. But having said that, it's very important for all this population on the move to basically have also humanitarian corridors for allowing preventive measures to be put in place, and also for allowing that the humanitarian assistance is still delivered to these people who need this type of assistance more than ever. I think these humanitarian corridors are also important for helping migrants in the most vulnerable situation to return back home. So to allow for all the stranded migrants, which are currently now have been for months stranded in the region, to go back home. So this is the first priority. It's about giving access for humanitarian actors, and access for basically moving back stranded migrant in vulnerable situation. The second area of priority, which we find very, very important in a time of pandemic, it's a universal access to healthcare system. And as I said, I think there's a policy in the region of offering treatment and care to everyone for COVID, but it's really important that the migrant population can access these services. It's also very important that at this particular moment in time, that even irregular migrants do not fear to ask for these services. I think the public health consideration should be given the priority. And the final priority area I would like to flag, we've just heard how important mobility is in this region. In fact, cross-border trade represents more than 12% of the trade value for the entire region. So I think the capacity to do this trade, to cross the border, to allow this trade to happen, and the movement of migrant workers to happen, is very important for this region. So in order to support the smooth reopening and a safe reopening of border, it's really important that the international community and all the international actors really provide their support to government to at point of entry to put in place measures for disease surveillance and tracking, and in order to allow these flows to resume in a safe manner. To conclude very briefly, we saw that mobility is an important factor of growth, and it's really important in terms of access to livelihoods for millions of people. So what we can see and say, it's really that everything that can negatively impact intra-regional migration will have a serious negative impact on the economy and the livelihood of millions of people in this region. So what we can say and advocate for, that's more appropriate to say, it's really for the benefit of the region. I think this pandemic should not be an obstacle to safe and regular migration in the region. So I think I would like just to conclude with this word and to thank you for joining us in this briefing. And now I would like to give back the mic to Vijaya Suri, who will introduce our response. Thank you.
Thank you, Sophie. Thank you very much and welcome participants. I believe the overview of the situation, mobility dynamics in the region, and the key priorities highlighted by Sophie are a perfect transition to be able to provide an overview of IOM's strategic response plan for the West and Central Africa. But before going into details about the strategic response plan, I think it might be useful also to provide some information on key facts and figures on IOM in West and Central Africa. For those who may not know, IOM's regional presence in these countries is over 20 years old, and we have an extremely strong operational presence with over 35 offices and sub-offices in 21 countries of the West and Central Africa region, all of whom are member states. We also have key operational staff in the volume of 2,500 colleagues who are spread throughout the region and present in often remote and difficult to access locations, most of the time far from the capitals, with the goal of supporting programs and activities seeking to promote stronger and more coherent approaches across the migration governance spectrum. Our area of work in this region, what we have been most actively involved in all the countries of the region, has been stems from a wide range of assistance, support, and services. Illustrated by promoting labor and human mobility, enhancing protection and assistance for vulnerable migrants, promoting the health of migrants communities, as well as our long-standing experience to address the challenges related to migration and mobility. So more specifically, as an example, we also work on root causes of forced displacement or enhancing border management, as well as focusing on trade facilitations. These are all key areas of work that fit into the key priorities identified by Sophie in terms of our response to the pandemic. And it is based on this experience that IOM devised its regional strategic plan to ensure a well-coordinated, comprehensive, and equitable response to the crisis underway. So today is the launch of this appeal, and we wanted to give you a bit of highlights and backgrounds of its content in more specific detail to showcase our operational and strategic approach to addressing the COVID pandemic. So IOM's West and Central Africa appeal is based on stems from IOM's global appeal. And the approach is focused and anchored on IOM's health, border, and mobility management framework. It is a framework around which IOM has tailored our response and identified the key priorities. It's also quite useful to know that this framework was first adopted in the West Africa region and then was adopted globally. It was adopted in West Africa during the Ebola outbreak of 2015 to understand how population mobility with disease surveillance can be addressed, and to prepare and establish a platform to develop either country-specific or regional approaches to strengthening health systems along the mobility corridors in line with the 2005 International Health Regulation. IOM's approach is also, of course, aligned with the WHO Strategic Preparedness and Response Plan, the UN Framework for Immediate and Socioeconomic Response to COVID-19, as well at country levels. It is in line with national preparedness and response plans. Next slide, please. Thank you. So through this appeal, we are aiming to demonstrate our capacity to tackle the pandemic as an organization by specifically addressing issues related to acute health and the multi-sectorial needs of affected populations and communities of concern. At the same time, we are also looking in this appeal at implementing programs and looking at ways to mitigate and address the longer-term socioeconomic impact of COVID-19 for countries in the region. So as part of this approach, IOM has focused its appeal on 4 strategic priorities at the community, national, and regional levels. The first priority of which is to promote effective coordination and partnership, as well as improve mobility tracking in the region, looking at the challenges faced by COVID. Second strategic area looks at how IOM can contribute to preparedness and response efforts for COVID to reduce associated morbidity and mortality issues, focusing specifically on how we can help improve infection prevention control, reinforce disease surveillance, strengthen border flows and processing at ports of entry, how to improve and enhance and promote risk communication and community engagement along in those focuses. And the colleagues in the field will be able to give more of a visual of what that translates operationally on the ground. The third priority is to ensure affected populations have access to basic services, commodities, and protection assistance. So this falls under the category of what Sophie had highlighted of leave no one behind. And finally, the fourth strategic priority is looking at how to mitigate the socioeconomic impacts of COVID-19 on countries' economies, but also most importantly on populations. Each strategic priority is then further broken down into pillar areas of intervention. And so for the West and Central Africa region, IOM's overall regional appeal stands at 54 million. Since the start of the pandemic, with support of partners and donors, IOM has already successfully mainstreamed mitigation measures to address challenges relating to COVID in all its programming throughout the region, including in its emergency operations. So far, roughly $9 million US have been collected and distributed in the region in terms of new funding that reported against the regional appeal. With this support, IOM, since March, has been able to provide direct assistance to 6,500 stranded migrants, has been able to assist hundreds and thousands of IDPs, and has raised awareness on COVID and preparation and prevention measures to dozens and thousands of people, mostly targeting mobile populations throughout the region. In terms of our work, my colleagues will be able to expand a little bit in more detail the types of interventions that have been highlighted, but I would like to draw your attention to the fact that most of the support that has been received so far has focused exclusively on public health support and immediate humanitarian consequences, primarily in the Sahel and around the Lake Chad Basin. However, the Sahel and the Lake Chad Basin is only a few countries of the region we represent, and the needs remain quite important throughout the region, And we would hope that this presentation and the regional appeal will also showcase the needs in the other countries, focusing on issues more broadly related to RCCE, case management, direct assistance, but also how to mitigate the impact of the socioeconomic impact of COVID-19 in areas like the Gulf of Guinea countries, but also in the coastal countries of the northern region of West Africa. So we would like to be able to focus and be able to improve our response throughout the region and increase the number of countries where we are able to deliver assistance to affected mobile populations. Next slide, please. The previous slide showed you an overview of IOM's strategic approach by pillars. Now, we thought it useful to show you a presentation by country in terms of priorities, to see which countries in the regional appeal have highlighted priorities and what those priorities are. At the country level, you will be able to get detailed information on specific needs identified in each country in coordination with national appeal coordination efforts. But I think it useful to inform you that the regional approach by strategic approach and by pillars is also followed at the country level for those who are interested. So the financial information outlines at the country level are also available to unpack some of the issues in more detail, highlighting specific issues and concerns of relevance to each country. Thank you very much for your time. And now I'd like to hand over to Aissata for Voices from the Field.
Yeah, thank you, Vijaya, for this, and to Sophie for the outlining the key priorities in terms of action for IOM to embark on, particularly highlight the priorities regarding the importance of humanitarian corridor to provide IOM the opportunities and and for the migrant to join their national countries, and this would be probably done and mostly done within the protocol of the countries individually, and also the importance of partnership that both of you have highlighted in the view of reaching out the migrant and the communities that are stranded in areas where the IOM response is important to provide. And among that, I will underline the importance of following WHO regulation to outline for this pandemic, and to be completely fully aligned with the other UN also agencies work within one UN response, which is very important to highlight here, because it's important to underline the interconnectivity of actions that all of us are delivering on the ground. And our colleague now will show us that also the importance of this interaction in many areas where IOM is intervening, and in the thematic focuses that we are having on the ground. So I will now pass the floor to our first intervenant within this segment, who is Anne-Catherine Schaffer. As I said earlier, she will brief us on the awareness raising and risk communication on community engagement in Chad. Over to you, Anne. Anne, are you there?
Yes, I am there. Can you hear me?
Please go ahead.
Thank you very much. Good morning. Could you go to the first slide, please? Thank you very much. So here in Chad, we are focusing our response on four main pillars. Primarily, we are supporting IDPs, returnees, and most recently, deportees from Libya with different measures, including logistical support to health authorities, through provision of tents, and lending our shelter experts to WFP for the building of mobile clinics. We are also providing wash facilities to camps, sites, and transit centers, as well as ports of entries. Specifically, support to points of entries is gaining importance here in Chad as rainy season is approaching and transhumance movements are moving into Chad along formal and, most importantly, informal or informal corridors, which are not monitored through the point of entries. IOM Chad is also focused on risk communication and community engagement. If we can go to the next slide, please. Specifically in rural areas outside radio and cell phone coverage, and in line with the WHO recommendation, risk communication and community engagement activities are focused on providing fact-based, contextualized, and comprehensible messages to communities outside radio and cell phone coverage area here in Chad. This is not only important to build trust and share information about available health services to communities, but also to ensure communities are aware when, where, and how they can access these kind of services. Very important in this regard is the timely sharing of information about preventative action taken by the government. Specifically, during the early onset of the crisis, a lot of issues occurred surrounding fake news about preventative action decided by the government. Addressing these and supporting correct information sharing is therefore paramount. Most importantly, the work includes increasingly the need to address challenges surrounding stigmatization of COVID survivors, as well as stigmatization of mobile populations often associated with carrying the virus between countries. Here in Chad, can we go to the next slide, please? We have focused specifically on trying to share information in areas outside cell phone or radio coverage, near border areas, and in areas with high mobility, such as transhumance. To this end, we're working with the traditional method of information sharing, the town troubadours, or crier public. They move through communities with bikes or on foot, on camels or on donkeys, and share information through song and stories. We aimed at not disrupting their routes, but to enrich their narrative with information about COVID. Currently, 107 troubadours, both men and women, are active, specifically in the far north at the border with Libya, and in those areas not covered by any kind of radio, TV, or cell phone reception. So far, we have reached about 250,000 people in different communities in the center and the north, with messages focused on COVID prevention, how to access services, self-protection, and on how to manage rumors and stigmatization. While other means of communication are also being used, like radios, SMS, newspapers, etc., the troubadours are able to share information in areas not usually receiving any kind of information, and they're able to do so in a culturally appropriate and comprehensible manner for the communities. Thank you.
Thank you, Jira. I will pass the floor to our colleague in Niger to speak about the stranded migrant impacted by the COVID. Please go ahead, Peter.
Morning, can you hear me?
Yeah, well.
Okay, could we move to the next slide, please? An overview of Niger and the presence of IOM. IOM in Niger is currently active in both migrant assistance, but also internally displaced population assistance. Talking about migrants, the majority of migrants in Niger are migrants trying to make their way north towards Algeria and Libya. IOM has transit centers basically in the north of Niger, around Asamaka, around Alit, Dirkou, and Agadez, to assist the migrants that are stranded and accept to return to their country of origin. Returns from in Niger that are found in Niger are mainly from Algeria, but with some small returns from Libya and also Nigeria. Can you go to the next slide? Since the closure of the borders, returns from Algeria have stopped. Again, as I said, Algeria is the principal country of returns for migrants. In 2019, we had 25,000 returns from Algeria. Majority of them from the ECOWAS were around 15,000. with only 10,000 from Niger, of Nigerian origin. Through IOM Niger flow monitoring networks, we collect information. Again, from the previous slide, we have flow monitoring networks in all the points highlighted in the map that show presence of IOM. And through this, we've collected information that shows that smugglers have increased prices due to the COVID situation with the closure of borders, reduced public transport within the country. Internal movements have also reduced due to public transport reduction in the country as measures taken by the government to mitigate against COVID. But despite all these measures, migrants continue to arrive in Niger. In early March, after the closure of the borders, we received 1,520 migrants in Asamaka, which is the farthest point in Niger with the Algerian border. And despite all these measures, we continue to see movements northbound within Niger. Again, the Niger borders are very porous up north with Algeria and Libya, meaning that despite the closure of official borders, other points of entry remain open, and migrants can continue through the smugglers with their movements. Next slide, please. IOM's response to COVID-19 has been mainly in direct assistance. We've supported the government of Niger, especially in setting up of quarantine centers for the returning migrants and the migrants coming from Algeria and Libya. We supported migrants from Burkina Faso. That was an official convoy organized between the Minister of Foreign Affairs from Burkina Faso and the Minister of Foreign Affairs from Niger, asking IOM to assist in transport of 1,500 migrants. So IOM set up a camp, as the photo shows, to quarantine the 1,500 Nigerians returning from Burkina Faso. We assisted with direct assistance in food, shelter, and wash. And this kind of setup has also been replicated in Agadez to quarantine the migrants that are stranded in the desert, that are assisted by IOM, are rescued by IOM through the search and rescue operations in the north. We also continue to support the government in points of entries, especially land POEs. We're setting up measures to allow the safe operation of these POEs. We've assisted with PPE materials, personal protection equipment for border officials. We've set up and reinforced their referral mechanisms for them to be able to refer suspected cases of COVID to the proper COVID response mechanism. And we continue to support them with quarantine assistance where and when needed. Next slide, please. Some of the main challenges remain country of origin approval for the humanitarian corridor. IOM Niger managed to get approval from the Minister of Interior in Niger to organize humanitarian corridors for the return of migrants. Currently, we still have over 1,300 migrants stranded, awaiting the voluntary return to their country of origin. The main challenges is mainly the measures in place by the country of origin and the conditions on how to return the migrants safely. For Niger, in case the reopening of the borders is also a problem, given that the poor infrastructure, especially in the north, on health structures, could in essential propagate the risks of COVID-19. The look-up of the national and regional government structures in managing migration, the migration portfolio is also a worry, because it makes that most of the assistance comes from humanitarian partners who do not have also the capacity given the limitations of COVID-19. That's an overview. The last slide just shows assistance of IOM in of the returns from Burkina Faso. The next slide, please. So the returnees was organized into the quarantine site that was managed by the government but supported by IOM in infrastructure and direct assistance. And there was military presence to avoid any movement in and out of the quarantine center for the 14 days that the returnees had to be quarantined. again, this capacity is not sustainable. It is very expensive to maintain a quarantine center, and we are pushing to support the government in identifying more viable sites that can be longer, more cost efficient than setting up camps every time we have returnees. That's the end. Thank you.
Thank you so much, Peter, for this outline, and to also, Catherine and yourself has underlined important issues, particularly on the need to contextualize the messages, but also the action that you are undertaking on the ground with the tools in with communities that are in remote area, and important to build on the IOM capacity to be a honest broker between countries to find the best solution of the best interest of migrant for their return, and particularly for those who are stranded in transit centers. Thanks to both of you for highlighting the importance, also not for to avoid stigmatization and to underline the preventive measures that have been taken in terms of awareness raising, but also in terms of practical setting of the IOM camps that quarantine centers as well. So thanks to both of you. Now I will provide the opportunity for Fatou to bring us on the health and in particular point of entry response and issue regarding the infection prevention control in Guinea. Over to you, Fatou.
Thank you very much, Aissata. Good morning, everybody. Thank you for giving us the opportunity to show you and to share with you what is happening concretely in the field. As you may know, Guinea was grappling with post-crisis recovery characterized by fragile institutions and systems prior to COVID-19. So this is linked to civil unrest and also to the big crisis, Ebola virus diseases. To date, we can say that Guinea has reported 4,639 confirmed cases, including 26 deaths, with a mortality rate of 0.54%, with an ever exponential growth in the number of cases and a trend towards more cases outside the current epicenter, which is Conakry. So the key challenges related actually to mobility restriction is that we know that since March 26, 2020, the Guinean government has instituted a state of emergency with the closure of borders and the prohibition of movement from the capital to the interior, which is very difficult. Our analysis of the context in Guinea, of course, could be summarized by the next following findings, which are the evidence of the imported cases reduction. We notify that since 2 May, no COVID-19 case from a traveler from outside the country has been reported in Guinea, which is very, very important. So at the socio-economic level, we note recently that with the administrative slowdown due to health control, but especially to the issuance of administrative certificates for travelers, thousands of truckers carrying most of the essential products like fuel, like medicines, like foods, etc., are blocked at the exit of Conakry for several weeks, which gradually contributes to slow the socio-economic vitality of the interior. So at the other level, we can, if we see for the persistence of the residual risk areas, despite all these travel restrictions, our data from our DTM system on the 11 formal port of entry show that 24,906 travelers entered Guinea between March 17 and June 6, which is very important too. There has been also a significant irregular cross-border flows. According to a non-published assessment in Kundara Prefecture done by us, flows in informal are 2 to 3 times more important in informal points, and imported cases are still through land crossing if a strategy is not put in place to control the unofficial crossing with the closure of official port of entry. So the other challenges that we can raise is that the diminution of the international seasonal migrants, especially in mining sector. The other one is that the difficulty to organize the return of irregular migrants to their home countries, and we are facing a lot of issues here in Guinea for this, because we have more than 300 migrants stranded in Niger, and it's very difficult to get them back home. So in terms of strategic intervention from IOM here, in terms of prevention, the spread will need to set up a clear control of population mobility between countries and cities. However, the control measures should ensure that essential mobility flows are maintained as much as possible during the COVID-19 pandemic, which is very, very important also. So it's necessary because we need to give access to food and medical products essential which are essential to lives, to save lives and limit negative impact on employment or and even the poverty. So to address these challenges, IOM Guinea promotes a very comprehensive partnership at the international level, and also with NGOs and also the private sector and the government of Guinea. It was to protect the health of the population while avoiding disrupting the free movement of people, which is very important, and the delivery of essential goods and services across the country through main components. The first one is the reinforcement of detection and isolation capacities at entry points and internal crossing points, where we have 27,000 travelers screened, and at the 11 port of entry equipped with isolation rooms and IPC materials, which is which is a very good help also to the government of Guinea. 10 health control posts along main roads also, and also supporting the government of Guinea to set up a travelers screening and testing center, TTC, for ground travelers, where we have 400 rapid tests per day for land trackers and other essential travelers also. In preparation to the reopening of the borders, another TTC is planned, and but at the international airports, and at this level, in this area, we really need to do a strong advocacy, because it's making this closure of border is very, very, could have a big impact on what we are actually doing. So reopening of borders will be necessary with some measure, of course. At the level of in terms of communication and community engagement across the mobility continuum, including the launch of a mobile application, which named Mon Passeport COVID, and it will allow to facilitate safe interregional and cross-border movement using a simple USSD technology accessible from any simple mobile phone and without internet connection, which is very, very helpful. After any negative, because after any negative test, this contactless application manages the safe and orderly passage of the travelers through the various health control points. Community-based surveillance, finally, in border areas surrounding informal port of entry. The network of the CHVS for cross-border event-based on the surveillance also, we have 444 alert notification, which is also showing that the system is good and well in place. So the public also, we have to share with you that the public-private partnership initiative also is ongoing, and the function as it functions as a multi-stage basket fund with 8 multi-sectoral flagship projects, and with the current government priorities through this framework, the private sector are actually doing a great the private sector through the Alliance for the Security, Sanitary Security in Guinea that has been put in place in last December before the crisis happened. This is a very good initiative too in Guinea in terms of prevention and response following the health. We are currently widely open to new partners to mitigate sustainably and together address the socio-economic impact of the COVID-19. But we really need, this is my advocacy, we really need to a reopening of the border, a safe, like Sophie said, a safe reopening of borders. But we need to join our efforts to get all these things to be done. Thank you for your attention. I hope that I give you an overview which could be more helpful for you. I'm here for the question. Thank you.
Thank you, Fatou. Indeed, you have provided us with a comprehensive briefing and outline of the main activities that you are undertaking in Guinea in such, as if you can say, volatile situation and with a political dimension, but also among all the importance of the experience gained from the Ebola crisis in terms of responding to the highlight that you provide in terms of screening and the POE equipment, the health control and awareness raising are very well presented during this briefing. So last but not least, I will give the floor to Frank Celestine to focus on the IDPs by the chain passing crisis and the northern East Nigeria. Please, Frank, you have the floor.
Thank you, Aissata. Good afternoon, colleagues. I'm here to present on Nigeria. What we have seen in Nigeria is a steady increase in the infection rate. The more testing the government does, the more people that we see infected. Not only because of that's a fact, but also because of the rate of infection. For example, so far Nigeria has only tested 96,000 people, and more than 17,000 of them confirmed positive. That's a rate of 20%. That is quite high, and when compared to the global average, we are quite concerned of the rate of infection in Nigeria. What's the issue here is the social economic impact that the crisis is having on Nigeria. Nigeria has had to revise its budget twice, which was pegged to oil prices at $57 a barrel. And at some point during the crisis, oil prices crashed, and we see an increase in inflation. What is concerning is the fact that a lot of people in Nigeria are not taking the virus seriously. And one of the key aspects of our work and what we're doing with the government is to encourage behavioral change to decrease the level of infection and the rate of infection, and to flatten the curve. What we see from the conversation we've had, especially with the migrants that are under our care, is that a lot of them have suffered greatly, and we may see an increase in irregular migration once the borders are open. So IOM is in fact trying to put a comprehensive measures in place to support the government of Nigeria to cope with the side effects of COVID-19, including addressing the socio-economic impact, decrease the rate of infection, and of course, for our concerned persons, the IDPs. And this is why that's the primary focus for IOM Nigeria today. IOM's with over 2 million people displaced in Northeast Nigeria, the spread of the virus will quickly, and the camps will quickly overwhelm the government's capacity and that of the humanitarian community to respond. So therefore, IOM's primary concern is prevention. And there are 4 key elements to our preventive measures. The first one is to decongest the camps. As you know, Nigeria has 49 sites that are overcrowded, with 411,000 people over the limit. The global standard of square footage for people in the camps is about 45 square feet per person. In Nigeria, it's less than 15 square feet. So you can understand that there is no such thing as physical distancing in the camps in Nigeria. So this is why prevention is extremely important on the way we address the crisis. So as the co-lead of the CCM NFI shelter sector, IOM working within this sector put a plan in place to decongest the camp, which was submitted to the governor of Borno State, and in coordination with the donors looking for funding to decongest these camps. But we want to make sure that decongestion doesn't mean return, and that if there is a possibility of return, that the necessary elements of return have to be in place. So it's quite a delicate issue to deal with because there are security measures that we need to put in place before we can decongest the camps. And of course, the politics, the local politics of the LGAs and the various entities within Borno State. So that's one key element of our prevention. WASH is the next key element because we want to make sure that people practice good hygiene to reduce the likelihood of them spreading the virus within the camps. So far, IOM has put in place over 321 hand washing stations. And a lot of these hand washing stations are contactless. We use a foot pedal to dispense the water and the soap. And the great thing about this, it was done some of it was done by the beneficiaries themselves, those that we're working with. They got training from IOM and they were able to do this themselves. So we are not only the co-lead in CCCM, but we're also the largest camp managers in Northeast Nigeria. So we take measures to reduce that. So that's the third element within our preventive measures. So far, we've built more than 20 self-quarantine shelters, and about 40 of them are under construction. And these shelters were designed to isolate those who may display symptoms or those who have come from a different area. We want to keep them separate from the population for 14 days before they are released to reduce the likelihood of them spreading the virus in the camps. These have, of course, they are self-contained. They have their own toilet, their own shower, and their own room to make sure that we keep them as far away, as separate as possible from the general population. And of course, now one of our key concerns, the rainy season is in Nigeria, and what we see on a regular basis is flooding of these camps, which increase the chance of waterborne diseases. So these measures are being put in place by the sector itself and also by IOM as an implementing agency to reduce these diseases. One key important side of our work and the last key element in the preventive mechanism that we put in place is the ports of entries, using our displacement tracking matrix to assist all of the partners, including WHO and the state ministers of health, to collect the data, which in case there is an outbreak, that would assist the government in contact tracing. One of the key problems of Nigeria right now is the fact that we don't know how the virus is being spread. Initially, especially with the index case, we knew it was due to travel. Then it was contact from people who came in contact with the virus. Now, the increased numbers we've seen have no source, and the government doesn't have the capacity to trace them. So widespread community transmission is of concern. So the data that we collect from the POEs is important. Since April, IOM has tracked the movement of about 1,800 persons through various flow monitoring points in 22 years. And this is important. The points of entries are incredibly important for Nigeria. And we are looking at this and discussing with the government going beyond COVID-19. We know there will be another pandemic. It's not an if, but when. How do we prepare the government and our partners to deal with the next pandemic in a better way? Building the capacity of the various government agencies at these ports of entries is extremely important to us. And this is something that we are quite mindful of. So building back better is embedded in our programming, and it's part of every discussions that we've had with the government of Nigeria. So looking at this, beyond the border crossing, we've seen people on the move in the areas of Chad, Cameroon, and Niger, where tribal links taken back and forth across the borders. So these are some of the key elements of our response, and we are working with the government as a partner to make sure these things are implemented and to ensure sustainability. But our primary focus now is to prevent, because once we have widespread infections in the camps, it will be incredibly difficult to manage, given that we have 2 million IDPs with those living on less than 15 square feet per person. That's a daunting task, but given the fact that we're looking at them ahead, it gives us an opportunity to put this in place and reduce the likelihood of this spreading as fast as we've seen it before. Thank you very much. Over to you.
Thank you so much, Franz, in providing us with the key element of the response in Nigeria, which is, I guess, one of the most important IOM presence in the region, if not in the continent. And we hear clear and very loud your important message on prevention, taking into account the local realities on physical distancing and in other challenges that you are having in terms of decongestion of the camp, in terms of wash, in terms of surveillance in POE. Thank you so much for that. And I just wanted to underline here that IOM is also have been mandated here by the African CDC to be the partners in the continental strategic response on COVID, and particularly in this region it is relevant, and Nigeria is one of the hub of testing, which is the important part of the COVID response in the region, with the spread of the cases that we are now having. So I would just would like to inform that as announced previously, we want to have this segment on hearing the voice from migrants. But before that, I just wanted here also to extend the thanks that the EU for the creation of the COVID fund that enable our colleagues that are presented, but also other countries in the region and in the continent to deliver as much as they can on the ground. So for the next part of our discussion here today is the question and part. So I will open the floor for any question, for any contribution that you may have. Please raise your hand, as I was trying to see if it was working previously, and identify yourself, and please, the floor is yours now. Anyone want to come in? So I see there is no question or comment. Therefore, I will end my moderating session here and give the floor to Sophie for the closing remark, and thanks to all for this important overview of what you are doing in the region. Thank you. Sophie, over to you.
Thank you very much. I just would like to give a word of appreciation. I think all the things that we were able to put in place so far, it's really the strong collaboration we have with all of you as partners in this region, and also to commend the efforts which were made by the government in this region. It will take throughout this presentation, I think in a region with very different crystals. There was a very commitment from government to try to take this crisis seriously and to support all the population, but also not to forget about the migrants and the diaspora. So I just would like to say this word of appreciation and thank you again for joining this briefing. And I think now I will leave it for my colleague, I think, to put in place some video that or to give the voice to also the migrants, so you understand the situation with their own words and from their own perspective. So thank you again for participating. Thank you.
Thank you very much. Thank you very much for the presentation. Is possible have this presentation, please?
Yes, please go ahead.
Hello?
Hello, can you hear me?
Hello?
Yes, we can hear you. Go ahead.
No, this is Massimo Progno from the EU delegation in Geneva.
Please, Massimo, good morning. You
Good
have
morning.
the floor. This is Aisata.
Yeah. Good, yeah. Hello, Aisata. Yeah, no, just since you mentioned the EU, hi, Aisata. Since you mentioned the EU, I just wanted to tell you that we are following closely and that we try to be present in the best way. That's just to show you that you have our support for your excellent work. That's it. Over.
Thank you so much, Massimo, for this acknowledgement, and for I'm reiterating as well the EU support, and without which we cannot achieve much of what we are doing in the region. Thank you very much. So, anyone else? If not, Sophie has. Do we have
Hello?
the word of
Aisata, can you hear me?
Please go ahead. It seems that we are having technical problems. Vijaya, can you direct us on that?
We can hear you.
We can hear you. Was there another question to be asked?
Hi, Vijaya, this is Melissa. Can you hear me?
Yes.
Yes, thank you very much for the very informative webinar. I just had one question regarding what's going on here in Cameroon. I'm taking note that IDPs are returning to their home locations, fearing, the spread of COVID in Douala and Yaoundé. I just wanted to ask questions regarding the infrastructures that are available in those at those home locations, and if ever those IDPs are returned to those main cities whenever cases are detected in those regions.
I believe I will defer that question to the IOM Chief of Mission in Cameroon.
Yeah, it was Cameroon.
Baka, are you online?
Yes, I'm online and I'm in a mission currently, so I can't share very well. Can you repeat the question, please, so that I might respond?
Okay. All right. So my question was regarding the IDPs that were returning to their home locations. Are there infrastructures available to take care of them in case there is an outbreak of COVID-19 in those regions, or are they sent back to Douala and Yaoundé, where I believe infrastructures are available?
Yeah, thank you very much. So currently, we were able to provide shelter and NFI to support the return, and also we are doing advocacy in order to help them getting food, etc. But basically, they return in their area of origin. Even the situation is worse, but they are able to with the support with the support from the humanitarian community to be able to be assisted at this level. So basically, from our perspective, we were able to provide to them a shelter and NFI, and we are doing advocacy, and very quickly we know that some of the actors will provide food assistance. So they assume that they will just try to understand the dynamic of the COVID, and then maybe they will return to the to the IDP's site, because the area is not really secure. Is also their choice to not come, to Douala, because they might have some kind of income in those areas. So Douala is a very big town, and it is very challenging for them to also be in this town. So basically, this is what we are able to provide as assistance, and we are advocating to get more assistance for those persons. I hope that I was able to respond shortly to your question. Thank you.
Yes, thank you very much. Thank you.
Thank you, Boubacar, for this outline. And do you have another question from our partners?
Hello.
Hello. Please
Okay,
go
so
ahead.
this is all right. Thank you very much. This is Collins from IOM Ghana. Thanks to all the presenters. It's been very insightful. But then a quick one to IOM Guinea. I think you mentioned that you're doing awareness creation. You've raised a lot of awareness on COVID-19 and then safe migration. Just want to know the form it's taking. Is it an awareness raising organized by IOM itself, or they are in collaboration with other people, and the form is taken. What medium are they using? Is it online or face to face? Other than I just want to understand the whole awareness creation going on. Thank you.
Fatou, you have the floor if you want to come in. Fatou, you are still there? It seems that we are missing Fatou due to technical issues.
Yeah, maybe any present. I mean, Celestine Sue mentioned that they are doing awareness creation on that. So I just we learn from each other. So I want to know the form is taking.
Hello, Fatou or Celestine, are you able to respond to the question?
I can take it. This is Anna from IOM Chad.
Okay, go ahead, Anne.
Yeah, so thank you very much for the question. I think that across the entire region, we're doing a lot of work on different methods of communicating and outreach work, to targeting different types of beneficiaries and different types of communities, be it border communities, health authorities, communities working on health responses, specifically migrant communities, mobile communities. And increasingly, and I think a very interesting tool that has been developed that we're not only sharing within IOM, but that we're sharing well beyond IOM as well with partners, civil society, local NGOs, international NGOs, etc., and the humanitarian community at large, are the regional information letters or briefs that are being shared regularly, and which are also focused on how these outreach communities outreach activities are being conducted in the different countries. And I believe there is one coming up in 2 weeks, specifically focused on the outreach activities that we're doing across the region. So hold on a little bit longer, and hopefully we're going to be able to share best practices from across the region then as well. Thank you.
Thank you, Anne, for this response. And I think we are now heading to the end of this session, because we have to close at 2:30 in Geneva time, 12:30 Geneva your time. So if there is no more question or a comment from our partners, allow me also to thank the technical partners, NGOs, civil societies, and other partners that are working with us locally to deliver and to help IEM team to be the best position to provide the activities and the actions that have been outlined today. And thanks for all for being here today, and for Sophie and her team for these excellent presentations. And over to you, Sophie, for the final words.
Thank you, Asaita. I think it was for us a very good experience, and I think we really valued especially your question and comments. We would like to encourage you, if you have any other question for us, please don't hesitate to reach out, and it will be our pleasure to provide you further information. Again, I just would like to thank all our partners in this response, again, the COVID, but also beyond that, all our partners who are always supporting us in IOM's work. So thank you, a big thank you for your attendance, and a big thank you for your collaboration and participation. Thank you to all of you. And with this, I will close this briefing. Thank you again.
Thank you.
Thanks a lot for this interesting presentation. See you. Bye.
See you. Bye.
Thank you very much. Bye-bye.
Thank you very much. Bye-bye.
Merci. Grazie.
Merci.